Hello, students. Welcome to chapter 15, weight management. So, chapter 18 and chapter 15 are the two chapters that are going to be part of your exam 3. Okay? So, in the United States, pay attention to these statistics. Currently, 71.6% of adults are overweight, of which approximately 40% are obese and 7.7 are extremely obese. This epidemic, which results in large part from poor diet, physical inactivity, and genetics, is not limited to adults because 18.5% of children and adolescents between the age of 2 and 19 years old are also obese. So, let's talk right now about obesity and weight control. Body weight versus body fat. Obesity is a clinical term used in a traditional medical sense for people who are at least 20% above their desired weight for height, denoting excess body fat. Overweight denotes a body weight that is above a popular weight for height standard. Meanwhile, the word obese is a more specific diagnostic term that refers to the degree of fatness, the relative excess amount of fat in the total body composition. Over the past 5 decades, the percentage of obese adults, those with a body mass index BMI of more than 30, has almost tripled. Again, over the past 5 decades, the percentage of obese adults, those with a body mass index of more than 30, has almost tripled. So if before they were 50 million, right now it's 150, right? Just to put a number. Although the relative prevalence of overweight and obesity among adults in America has remained steady over the past decade, it remains at epidemic proportions. So that's good to know. The most important factor in determining fatness and leanness is body composition. Okay, body composition. Let's move. BMI is a reliable method of predicting the relative risk of becoming an overweight adult. Children and adolescents who are overweight or obese are significantly more likely to continue to suffer from obesity as they age. Now, the exclusive use of BMI is to define obesity has gone criticism. And this is why. Because, for example, if we have a football player in peak condition can be extremely overweight according to a standard height and weight, right? Let me jump until here. So, the according to the standard height weight charts, that's for individuals with significantly more muscle mass than the average person. BMI cannot be the ideal means by assessing health risks associated with weight. To increase accuracy of assessing chronic disease and mortality risk, the use of waist circumference is included because the greater the amount of adipose tissue stored within the abdominal region, the higher the risk for disease and all-cause mortality. I think I explained this in class. When you see somebody with distended abdomen and a lot of adipose tissue in the abdomen, that means that person is either having hypertension, diabetes, it could be a risk for any other, all the conditions, all the diseases starts in the gastrointestinal. I keep repeating this over and over because that is the truth. So again, where is the part? Okay, to increase accuracy of assessing chronic disease and mortality risk, the use of waist circumference, that means we have to take into consideration the abdominal distension, is included because, here we go, the greater the amount of adipose tissue stored within the abdominal region, right? the higher the risk for disease in all-cause mortality. So that's very, very, very important. So here the book is including a couple of definitions, body composition. I really want you to pay attention to these concepts. Body composition is the relative size of the four body compartments that make up the total body. So body composition is conformed of four compartments: lean body mass, which is the muscle mass, fat, water, and bone, right? So we have the lean body mass, the muscles, fat, water, and bone. In other words, muscles, bone, fat, and water. Those are the four components of the body composition. Now you have also the body mass index. So the body height in kilograms divided by the square of the height in meters. Kilograms divided in meters. Okay, the square of the height in meters. Okay, so let's move. Here, for example, we have the trends in overweight, obesity. On the left side, we have the percent, and then we have on the bottom the years, right? So this is your XY, right? So from 1960 all the way to 2016. So you can see, for example, obese men in 1960 were 10% of the population. Right now, through the years, the obese men went all the way to almost 40% of the population, the obese men. If you observe the overweight men and overweight women, somehow they are, stable. In the case of the men, the number decreased a little bit in comparison with 1960. But you can see in general, obese women and men, the numbers are going high and high. Also the severely obese men, not in the amount of percentage of the obese woman and men, but it's increasing. Okay, so this is a table that must be in your memory, the body mass index. You need to know what is a normal weight in terms of BMI, what is obese. The BMI between 30 and 35 is obese, and above 35 is extremely obese. Let's talk about also remember the waist circumference and increased risk, right? You have to remember this. And more than 40 inches in men is not a good indicator. And in women, more than 35 also is a bad indicator. And they are included in the criteria of the metabolic syndrome, remember? The waist circumference, blood pressure, triglycerides, glucose, okay? So this is important that you know. Body composition is not always easy to measure in clients. Therefore, the recommended standard for assessing health relative to weight is the BMI and waist circumference measurements used together. Health professionals can measure body composition with a variety of methods. Okay, so we have the body fat. I want you to pay attention because these two tables are divided by gender. So the first table is the BMI, estimated body fat by BMI for females. So we see here that in the BMI between 20 and 39, right, the body fat percentage increases to the age of 80. So we are in an increase mode, right? But for example, because the bottom, understand that the bottom represents the year, and on the left you are having the body fat percentage. But so from 20 to 39, let's say, the body fat is 35%, right? But this curve increases when women become 80 to almost 40%, 35, 38%, right? This above 35% of body mass. So in terms of BMI for males, ooh, the curve goes nuts. 20 to 39 years, they have barely 22% of body fat percentage, but when they become 80, they are almost 30. And this body fat percentage correlates with body mass index. In the first table, females, and in the second table, males. And and you have to remember that a BMI of 21 to 25, okay, lower the risk for chronic disease in patients. So the lower your BMI, the lower the risk for chronic diseases. Now, here they are mentioning some type of body composition, right? Health professional can measure body composition with a variety of methods. I really have to apologize that I'm going back and forth on this, scrolling up and down, because the tables and the topic they are bringing to the table are not the same if we try to follow the book. So right now we are going to talk about the body composition methods, how to measure body composition methods. So we are going to jump. We're going to start talking about skin fold calipers, measure the width of a skin fold at precise body size, because we deposit most of the body fat in layers just under the skin. We know that. We studied that in another chapter previously. Now, this is the one that I want you to remember. Hydrostatic weighting is a more precise method and is often more used in athletic programs and research studies. Although with advanced technology, it is not used as frequently now. Hydrostatic um, weighing requires the complete submersion of an individual in water. Complete submersion of the individual in water. For an accurate reading, the person must exhale as much air as possible and then remain as still as possible underwater. As you can see, it's not a method that everybody can do. So although this method is relatively accurate, it is not easy, portable, or inexpensive, and many clients are not willing to or able to perform this test. So this is the most precise method to determine body composition, and that's good to know. Okay, the most reliable method. The hydrostatic weighing or the underwater weighing, right? Now we have bioelectrical impedance analysis. The BIA is an easy, portable, inexpensive, and non-invasive body composition measurement tool. One type, a foot-to-foot analyzer, requires that the person stand on a modified scale with bare feet while an undetectable electrical current travels through his or her body, right? It's like stepping on a scale. And then here we have the picture of the caliper, the skin fold caliper, right? Here I'm measuring the skin at the level of the arm, you see? Yes, it's on the arm, in the back of the arm, right? And this method is measuring the subcutaneous fat. And then we have the air displacement plethysmography, the butt pot machine. It is expensive and not portable. The butt pod requires the individual to sit in an egg-shaped device wearing tight-fitting clothes, and calculates the percentage of body fat using weight, butt volume, thoracic gland volume, and body density. It's not for individuals over 500 pounds or those with a fear of confined spaces. Okay, and then we have the DEXA. It's a highly accurate way to assess body composition using radiation to distinguish bone mineral, fat-free mass, and fat mass. So here in the graphic, we have the one that is the scale, the bioelectrical impedance body composition. And then we have here the bad part is the egg-shaped machine, right? Using air displacement technology to measure body composition. And then we have here the DEXA, the dual energy X-ray absorptiometry. Okay, so a body fat content within the range of 21 to 25% of total body weight, typically equivalent to less than 25 kilograms of BMI, is usually associated with the lower risk of chronic disease for adult men. And for women, the range is somewhat higher, 34 to 38%. So that's good to know, also good to remember. Okay, measures of weight maintenance goals. So we are going to measure the standard height and weight tables. High weight tables are only for general population guidelines and not the sole diagnosis tool for all individuals, right? So here we have a couple of tables. This is going to help us to predict the percentage of fat in later years. So for example, let's try to check the one in purple. So here at the bottom, we have the age from 0 to 100, and we have the percentage of fat, the prediction, right, from 0 to 30. So at 20 years, right, they have somehow 21 percentage of fat. So this individual at the age of 80 is going to have more 27, more or less 27 average percentage of fat. And you can analyze, this is for men. Let's see how is the graphic for women. So for women, it's going to be yep, almost the same in the purple, right, region, the non-Hispanic black. But if we check the Mexican American, which is the red, at 20 years, they already have 37% of fat. That's impressive. And then at 80, they are going to have almost 40. This is the Mexican American. In men, they are going to have at 20 years 25%, and at 80 they are going to have a 27. So the change, yeah, it changed a little, but the dramatic change is in the Mexican American woman. Okay, so more recent high weight tables rely on BMI calculations from the National Research Council data for weight and health, and the current dietary guidelines for American and recent medical studies. These guidelines directly relate height and weight ranges to relative risk for chronic diseases. So the amount of fat, again, to summarize, the percentage of fat in the body is going to determine, especially if it's a abdominal fat, right? Adipose tissue in the abdomen, based on the waist circumference. Okay, I'm putting all the concepts together. That is going to make a prediction of how many chronic conditions this person is going to have in their senior age, right? When they become elderly. Okay, so with each age group, obesity is significantly associated with higher all-cause mortality rates. Yes. So healthy weight range. The HAMWI method is a basic calculation for determining a healthy or ideal weight goal relative to sex and height. So this is good to know. It's going to help you to calculate where you are and where do you want to be in terms of ideal weight. So for men, for example, 106 pounds for the first 5 feet, then add or subtract 6 pounds for each inch above or below 5 feet, respectively. A range of plus or minus 10% accounts for small and large body frames. So, for example, we have a man that is 5 feet 11 inches, okay? So the 5 feet is going to translate into 106 pounds, and then we have 11 inches multiplied by 6, right? So it's going to be 66 plus 106. So the ideal weight for these men 5 feet 11 inches is 172 pounds. The same thing for a woman. Let's say it's a 5 feet 3 inches woman, so it's going to be 100 pounds for those 5 feet, and then 5 pounds for each inch above or below. So let's say 5 feet 3 inches, so it's going to be 5 pounds multiplied by 3, because there are 3 inches, is 15, plus 100 is 115 pounds, is the ideal weight for this woman of 5 feet and 3 inches, right? Relying on ideal body weight calculations must include consideration of the following: frame size, variation, and essentially of body fat. So frame size, variation, and essentially body fat. So body frame, right? We can estimate a person's body frame size by dividing his or her height in centimeters by their wrist circumference in centimeters. So I have included a video here. There is a link here. Also, we have, so if we divide, right, the height in centimeters by the wrist in centimeters, we are going to obtain a number. And here is the table that correlates with that result. For example, if you have a height of 5 feet and 4 inches, which is 64 multiplied by the centimeter is 162.56 centimeters, okay? So I am basically converting 5 feet 4 inches using the centimeters, and it's going to be 162.56 divided by the wrist circumference, in this case 15.8. This is the number 1029. 1029 is going to be here, right, in the based on this table is gonna be 2029, so is here medium 10.4 to 9.6 in the case of a male, and would be 10.9 to 9.9 in the case of the female. Okay, individual variation. Ideal weight varies with time and circumstances throughout the life, right? A person ideal weight depends on many factors, including sex, age, body shape, metabolic rate, genetics, physical activity, and overall well-being. Just as everyone varies in shoe size, the same thing happens with the body weight. Necessity of body fat. Some body fat is essential for survival, right? Every cell membrane in the body has fat molecules within it. Fat provides insulation, temperature regulation, the cushion of vital organs, and many other functions. The estimated essential body fat level, the minimum amount required for health, is approximately 3% for men and 12% for women. So the estimated essential body fat level is approximately 3% for men and 12% for women. Okay, these are minimal amounts, okay, of body fat and not optimal levels. These are minimum amounts and not optimal levels, okay? Health and hormonal regulation decrease with inadequate body fat and severe caloric restrictions. So here what they are telling you is that if you don't have um, an adequate and optimal level of body fat, your hormones are going to start behaving cuckoo. Okay, so watch out with those diets that are fat free 100%, or if you are doing excessive fasting, you have to pay attention to that. Okay, obesity and health. Weight extremes, clinically severe or significant obesity is a health hazard and creates other medical problems by placing strain in all body systems. We know that. Overweight and health problems. Obesity increases the risk of related conditions such as hypertension, type 2 diabetes, heart disease, arthritis, and certain types of cancer. We spoke about that already, right? When we see somebody with abdominal distension, we have to suspect about this type of problems, right? So we are going to stop here, and when we come back, we are going to speak about the causes of obesity.